Hi, everyone. My name is Dr. Chalice Rhodes. I'm a licensed professional counselor, national certified counselor, and board certified telemental health counselor. I am also a breast cancer survivor, and I turned my pain into purpose by becoming a cancer oncology behavioral health specialist. Today, we're going to talk about navigating conversations, strategies for discussing metastatic breast cancer with your loved ones. We really want to have open discussions about what metastatic breast cancer is with our loved ones. So we really need to understand emotions. Our loved ones need to understand emotions. We need to emphasize the need for empathy and compassion when engaging in conversations about metastatic breast cancer. We want to educate our loved ones by sharing basic information about what metastatic breast cancer is. We want to provide resources for further understanding. We also need to stress the importance of dispelling myths and misconceptions about metastatic breast cancer. Sometimes people assume that chemotherapy, is needed. Perhaps it is, but maybe it's not. Maybe a metastatic breast cancer thriver is prescribed a pill. The other thing is that treatment does not end for metastatic breast cancer. So once a treatment stops working, then doctors will prescribe another treatment. So these are some ways that we can educate our loved ones on what metastatic breast cancer is. Now, we also need to set boundaries. Setting boundaries is so important. Sometimes people think it's difficult to set the boundary, but I would say that it's more difficult to maintain the boundary, because as soon as we set a boundary, one of the very first things most people do is push right up against that boundary. So we do need to set clear boundaries about what is comfortable for us to talk about. Maybe at times we are comfortable discussing our diagnosis and talking about the details, but maybe on some days we're not. So, a technique that really helps with this is assertiveness. Assertive communication is so important. Here is a blanket statement that you can practice when being assertive. So, first, you want to state what you feel. So, I feel uncomfortable when the person does this. So, I feel uncomfortable when you randomly bring up my metastatic breast cancer diagnosis. The next statement is a statement about what you would like to see for the future. So, an example might be, in the future, I would like for you to check in with me to see how I'm feeling about speaking about my metastatic breast cancer diagnosis. Now, we also want to address insensitivity. We do have to acknowledge that insensitivity of our loved ones can be unintentional. People make well-intentioned comments. They may be trying to show you that they care, but they're not really educated. They're maybe not really in tune with how you're feeling, which is why empathy is so important. Empathy, not sympathy. Empathy is the ability to understand a person's perspective. So when we are demonstrating empathy, we want to try our very best to imagine how this person might feel receiving a life-changing diagnosis, such as metastatic breast cancer. We want to try to imagine, if I received that diagnosis, how would I feel? What might I be thinking? We can help to educate our loved ones on how we are feeling and where we are coming from when we are ready to talk about it. We also want to seek support together along with our loved ones, right? A support system is so integral to recovering, to surviving, to thriving through this lifelong diagnosis. So when we think of resources and a support system, I really want you all to think about it. A mental health support system, a physical health support system, and a spiritual health support system. Our mental health is our thoughts, our feelings, and our behaviors. Our physical health, our diet, our exercise, our sleep. Our spiritual health, our relationship with a higher power, our relationship with God. Maybe you feel very spiritual when you're connected to nature. So there's so many things that can go into it, but it's just so important for your self-care and to help you to thrive. And then we want to encourage family and friends to join support groups and or counseling sessions with us. So maybe you can invite a family member to a group. Perhaps there's a group that's specifically for caregivers, because caregivers also experience symptoms related to their loved one's cancer diagnosis. Common symptoms are anxiety, depression. Some people experience post-traumatic stress disorder. Distress is experienced differently among everyone, including caregivers. So it really is important to engage the family, friends, loved ones in counseling resources and support groups that are specifically tailored to caregivers. It was my pleasure to speak with you today. Have a great day.